Good afternoon. Thank you all for joining us. We are going to get started right away with the folks that we have in the room. And I'm going to actually share a presentation screen to keep us organized. And I'm going to allow our guests, our presenters here to take the lead as instructed. So let me share the presentation screen and get us started. Say share.
Slideshow.
Yep, that was me. I'll keep putting that. All right. And thank you so much, Christina. Thank you.
Okay. Hi, welcome and thank you so much for coming to our Reimagine Policing in Baltimore community discussion. This is an opportunity for y'all to learn a bit more about the project that we're working on, as well as ask any questions you may have. I will pass it over to my colleague, Brian.
Thank you, Christina. My name is Brian Beverly, and now I'm going to ask each member of the team to introduce himself or herself. First, we have Dr. Natasha C. Pratt Harris, Principal Investigator.
Good afternoon. I am Natasha Pratt Harris, and I just want to acknowledge that Christina actually just posted a link in the chat. This particular link, if you have questions throughout this presentation, you can use that link to post your questions. If you, in fact, have questions at the end, you'll be able to ask them, and we should be able to answer some of them or all of them in real time. So let's take a look at the chat. I am Natasha Pratt Harris. I am an associate professor at Morgan State University in the Department of Sociology, Anthropology, and Criminology and Criminal Justice. I'm also the principal investigator for the Broaden team on the Morgan State University side. This is a collaboration between Morgan State University and West Virginia University, where we were awarded a National Science Foundation grant. We are thankful that you are here joining us and partaking in a discussion. Many of you have gotten information from our fellows who wanted to share what we're doing to make certain your voices are included. You got an email, a phone call, a letter. So we wanted to give a name to the faces of folks that you were introduced to via email or otherwise. Thank you so much for joining us.
Thank you. Next, Dr. James Nolan, Principal Investigator.
Hi, everybody. My name is Jim Nolan, and I'm a professor and chair of the Department of Sociology and Anthropology at West Virginia University. Very happy to be part of the team and here today.
Thank you. Next, Bishop Dr. Kevin Daniels, co-PI.
Good afternoon. Glad to be here. Professor, associate professor at Morgan State University School of Social Work. My focus in research is urban populations. Excited to be a part of the team. A lot of my focus has been on communities and organizing as well. So I'm excited about that and some of the work that I do on the grassroots level in working with not only communities across Baltimore City, but also working with faith-based entities across the city as well, and reuniting and joining them for community uplift. So I'm excited to be a part of the team.
Thank you. Next, Dr. Henry Brownstein.
Hi, I'm Henry Brownstein. I'm a distinguished research professor in the Department of Sociology and Anthropology at West Virginia University. I am very interested in this project. I think it really is an important project for linking research and allowing research to inform policy and practice. And I'm hoping that this will be useful and something that folks can work with. And we have a 3-year project. We're starting now, and we're looking forward to working with you. I just want to add also that for 5 years, I was a professor at University of Baltimore, so I did spend some time in the city. Thank you.
Thank you. Next, Dr. Paul Archibald.
Yes, good morning. This is Paul Archibald. I am assistant professor in the Department of Social Work. the College of Staten Island, City University of New York. My research area is in stress and trauma as it relates to stress-related health disparities, and I'm happy to be a part of the team.
Thank you. Next, Ms. Rosa Hayes.
Good afternoon. I'm Rosa Hayes. I am a second-year master's student at Morgan State University, and my major is sociology, and I am a research fellow on the team.
Thank you. Next, Ms. Christina Williams.
Hi, my name is Christina Williams. I am a first-year sociology master's student, and my focus is data on the research team.
Thank you. And yours truly, Brian Beverly. I'm a master's program in sociology at Morgan State. I'm also outside of school with the Bureau of Labor Statistics, but as relates to this project, I'm also a member of the board of the Charles Village Civic Association, and it was through the association that I was able to make contact with many of our participants today. So thank you.
Thank you. And Dr. Archibald and Bishop Dr. Daniels will be sharing about the PACE project model.
Yes, awesome. And so again, Paul Archibald, I was one of the co-PIs on the Police and Community Engagement Project, along with Dr. Daniels, with this project, which is why we're excited about the reimagining model, is because this is one of the things that the community asked for when we completed this part of it, which was to continue the process, and we see this as a continuation of the process. And so we received funding at Morgan State University. I was a professor there at that time, but we got the funding from the Governor's Office of Crime Control and Prevention, and also from the City of Baltimore. And so the project was really about involving community and police in what we were calling solution-based discussions, to really to achieve better relationship between community and police, with outcomes of really trying to end some of this racial trauma and violence, and working towards rebuilding a better Baltimore. And so we created this, what we call the PACE team, in partnership with the Ministers Conference of Baltimore and Vicinity, and in conjunction with the Baltimore City Police Department consent decree, the implementation unit. And so we held 9 3-part discussions, which really turned into 10 because we had a youth version. And so we went across the 9 districts, the 9 police districts that sit in the 14 councilmanic districts. But we included, because the community felt that we needed to hear from the youth separately. So we end up having 10 because we had a youth session. And so what was included in that methodology is that we had a community focus group, which consisted of community members only. We had a series of questions that were asked, and some of those questions included, what do you think is the relationship between police and community? What are some of the barriers, and what can we do about it? And then we had a separate police focus group. And what I want to talk, just briefly understand about the police focus groups is that whatever district we was in, there was a representative from each district. So what that meant is we had a minimum of 9 police officers in each of the districts. So if we were in Weston, we had somebody from Weston, we had somebody from Easton, we had somebody from Southern, that was a part of that. And these were sworn members, and it included sergeants, detective officers. And this is people who were in Baltimore Police District only. And then after that, we did a community conferencing. So we had the same Baltimore police officers and the same community members, coming together in one community conferencing session, going through the responses. We did a thematic analysis. We looked at the themes, we discussed those, and we came up with some recommendations. And so the reason why we did that was to gather insight from the participants to bridge the gap of communication. And so that's really what we did in bringing those things together. Dr. Daniels, you want to add some of the results?
Yeah, I think that some of the strengths, weaknesses, and opportunities that we did see was, as most of you can imagine, in building any types of relationships of that kind of magnitude, where people talk, where people listen, where people have an opportunity to be empathetic, and they have an opportunity to communicate and to hear the other person's story, and to realize, of course, that we all share the same perspective, which is our humanity. And after hearing the officers listening to community, of course, persons wanted these kind of relationships to continue in perpetuity, even as we presented the information to the police department. Again, sometimes policy trumps people. And in some cases, that level of perpetuity did not continue. However, in being a native of Baltimore City, some of those relationships are still intact. And it will just be extremely helpful to find, as we go through with this project, to find some of those same kind of relationships, either enduring or creating an opportunity, as my colleague said, to reimagine what could be something more in perpetuity and sustainable. While we did have challenge in some of those settings, because again, in focus groups and or community conversations, there is always going to be outliers. But because we were there for the specific reasoning to not only just communicate, to build stronger partnerships, because one of the things that we're clear about is the fact that in any municipality, there is no way that one entity or one system can bring the kind of change that needs to take place. It needs to be an ecological perspective where several entities from macro, micro, and mezzo come together to bring that level of success. So a part of some of those outcomes and some of those findings, of course, were continuing relationships and more relationships, but again, policy within the system itself, and how it impacts community, what was extremely challenging. So a part of this process is re-engaging it, but I think that what this process looks at is not just re-engaging it, but also reimagining what is possible, and not just what is possible, but what does work, and in some cases, what doesn't work. And I'm excited about it. And of course, in talking with several communities already, they're excited as well.
Thank you. And Dr. Nolan, Dr. Brownstein will be sharing more about the specifics of this particular initiative. Thank you.
Hi again, I'm Jim Nolan, glad to be here again. My research over the past 20 years has focused on the law enforcement and crime control approach to policing. I've seen that in these modern times that there's been an overemphasis of law enforcement outputs, such as arrests, convictions, seizures of illegal drugs and guns, and it's become sort of the purpose of policing, this law enforcement approach. And so when we talk about reimagining, we're asking the police agencies, really we're doing this and we're thinking of this in Baltimore, but really throughout American policing, is suppose you reimagine your job as not creating law enforcement outputs, but creating community outcomes, helping to create community outcomes. And so we think that the PACE model was such a good model in terms of building these relationships, dealing with local trauma, both on the part of the communities, but also inside police agencies. If this becomes the game the police play, building strong communities, we think that this is a much better way to think about policing going forward. And I think Henry's going to weigh in on how we might do that.
Thank you. Again, this is Henry Brownstein, and we're doing a project. I will say, in 1970, I did a study of minority attitudes towards police discretion, and basically what I was finding was that people are really concerned about safety in their neighborhoods. And that's really the focus of what we're doing. We're interested in strong and safe neighborhoods. And what we're doing here is we're going to take the model of PACE and try to see if we can come up with something that is more sustainable. And again, I don't speak for PACE, but I'm just saying that we're looking to do something that will bring together in a partnership people in communities, other stakeholders in communities, people from the faith communities, business people, all sorts of folks who have any interest in a community with the police working together to make the neighborhood safe and strong. And we're looking to get measures of how that would happen. Now, Jim has experience in police work, but he also developed the idea of situational policing, which looks at the neighborhood and the characteristics of the neighborhood as being very important in terms of creating that trust and that respect that's necessary in a community for people and police to work together. And what we'll be doing is, with you, we hope, is developing a partnership, not only with the communities, but with folks who work in the area, who have people in Baltimore who are able to look at this work and look at these ideas and think about what we need to do to make it happen. And we're hoping that whatever we do, we can be working with you throughout the process. We're at the beginning of a 3-year study, and we're hoping we can work throughout the process to try to figure out what we need to ask, what we need to do, what outcomes we should be looking for, what kinds of things we should be measuring, so that it's not just us, but this is a participatory action research project, which we're hoping will make you partners with us in helping us to figure out how to make this work. So what we're going to do is we're going to select neighborhoods, and we're going to do surveys before and after the intervention. We're going to compare outcomes in terms of community characteristics. We're going to look at official statistics. We're going to try to come up with measures of whether or not we can actually see a change over time in whether or not we have some evidence that folks are working together, there's more trust, there's more respect in the community, but also that there's less crime. There's people responding to crime differently, the police responding to crime differently, and we're hoping that we can find out how to measure that and how to bring that about with your support. So this is really a project that's not just us trying to do something so we can get more articles written, but really to make a difference. And we're hoping that we can work with you to do that. Thank you.
Thank you all so much. I'm going to be sharing a little more about why we are having this discussion today and the model that emphasizes community voice. So for those of us who are on the Zoom call, and for those of us who are going to be seeing this recording, I'm hoping that you take the opportunity to kind of embrace this moment in so much as acknowledging that we have a team of folks at Morgan State University, West Virginia University, and CUNY in New York, with Dr. Archibald being the PACE model person, along with Bishop Dr. Kevin Daniels, and actually post your questions using that link, because we actually are asking for inviting community voice throughout this process. The actual model itself is a community voice model. Community meaning those in the communities that will be selected for this initiative, and the community of law enforcement professionals that are in Baltimore City. We'll be doing a quantitative and qualitative approach to identify hidden psychodynamic processes that shape the neighborhood environment. And when we talk about reimagining policing and making neighborhoods safe and strong, we're looking at the influence of neighborhood climate, crime, violence, drug use, and other social problems. And how do we get to be able to address these things? It will be, the model includes, for example, Dr. Brownstein talked about this, a PAR liaison, participatory action research liaison. This is a community member that helps to bring the people together, law enforcement and community members together in designated spaces to have these conversations over the course of the time that we'll be doing this work. We just so happen to be members of the research community, being university professors and researchers. We were able to apply for a National Science Foundation grant. We were awarded this. It comes about because of our being a team, and the folks you see on this call are actually a part of a team that were able to make this happen. But the total team includes you, community members, law enforcement, and the stakeholders that were mentioned earlier, especially by both Brian and Rosa. So, you know, what you're seeing, even on this visual, speaks to that model, and really, you know, embracing and utilizing and asking for your voice, opinions, suggestions. What are we doing that makes sense in so much as what you're learning today? What can we do better? And so that's the entire point. So thank you for that. And next up, Rosa.
Good afternoon. Again, I'm Rosa Hayes. I want to thank you all for joining us for a Reimagining Policing discussion. We would like to take this time to open up to any questions you might have right now. If you don't have any questions at the moment, the link below can be used to ask questions at a later time, anytime. Someone on our team will be happy to answer them. So at the time, if anyone has any questions, please feel free to unmute yourselves or type in the chat and we'll be happy to answer.
I have a question about the last slide. If you could give an example or examples of psychodynamic processes, hidden psychodynamic processes, or however.
Thank you. And I'm not sure who's, oh, Rich. Okay, great. I wasn't sure who was speaking because I had my screen covered. So I'm sure Dr. Nolan would like to chime in on that. This is his area of expertise, his specialty.
Sure. About, let's see, 15 years ago, I received funding from the Department of Justice to develop metrics of community safety. And we looked at these psychodynamic processes. These are latent processes that begin with, what are the expectations you have, people living in close proximity to each other, have of each other, and have of the police and or other authorities, government leaders, and those sorts of things. Where those relationships are strained, these are places that are that can be very dangerous, and where relationships are broken apart, people avoid each other, those sorts of things. These are places that actually they create an environment where crime is likely to thrive. So our attempt is, if we can develop some of these ways to see these metrics, what we sort of conceive of it this way. I'll put it this way. It's like a container that contains 3 levels of this substance. One substance is called interdependence. This is cohesion and trust in the community. Another substance is conflict and frustration. And this is you know, at some sort of level. And another substance is levels of dependence, like, you know, I don't know my neighbors very well, but I depend on the police to come and take care of things. Anyway, the psychodynamic processes lead to this atmosphere, levels of interdependence, levels of frustration and conflict, or levels of dependence. And depending on the combination of these levels, this is how we predict whether a place is going to be safe or not safe. And a lot of times what the police do with their law enforcement is create conflict. So they unintentionally create the type of dynamic processes in communities that actually contribute to crime and make crime thrive.
Also, another way you can look at that is, let's think, there's events that happen. Let's look at childhood. There's some things that can happen in a childhood's life, like something happens that made them afraid, and then they start biting their nails, right? So when you talk about psychodynamic, that's what it's really referring to, is that something in the emotional and mental forces that then causes something to happen. And so that's what we're looking at. What are some of those things that are happening, some of the emotional things and mental things that are happening in communities that's causing some of the things that are happening with policing in communities? So trying to make that kind of clear. So something happens, right? And it creates a behavior. It creates an action.
That was, thank you both so much. I think that was helpful. Rich, did it answer your question?
Yeah, so in this context, just anecdotally, whether it be made up or true, could you give give an example of that cause and effect where in the context of a police community engagement scenario?
Yeah.
Go ahead, Dr. Nolan.
Yeah, we've been measuring this, and we've looked at 16 neighborhoods in Cleveland and Pittsburgh and in Wilmington, Delaware, and those types of places. And so in places where where there is this conflict between the police and the community, these are places that are the most dangerous. I mean, if you look at places that have high levels of conflict between police and the community, or among community members, these places are almost certain to have crime. We can predict by calculating probabilities that crime is going to occur, and it's almost a 98% chance that crime is going to occur in a place that has high levels of conflict and low levels of interdependence within a 12-month period of time. But if you can reduce that by building levels of interdependence, higher levels of interdependence, it drops to it's less than 1% in some places. And not only does it predict crime, but it also predicts whether residents are willing to support people coming back from prison, or if they're willing to reach out to a neighbor who's suffering domestic violence, or lots of other things. It's like what Dr. Archibald said. It's it's within the person, but it's these conditions that create this probability, this chance that something's going to happen on the outside.
And just from the pace standpoint, I'll give you a quick example. Police officers identified their level of experience with trauma. All right, so they talked about having all of this exposure to trauma. Some had exposure to trauma as children that went unresolved, and then we had some police officers who also came out of military at the same time. So you have that complicated trauma, plus now they've been exposed to trauma in community when interacting with community members. Okay, so you have that piece. Then you have community residents who also identified having experienced racial trauma as children. So you put those two together, right, that we haven't talked about because that didn't come out before. You put those two together, you have a poor interaction with people. You have both traumatized people who didn't realize that the others were traumatized, interacting with each other.
Can I add one more piece to this? There's been a tendency to think that sort of affect people, there's a feeling that we get it's all internalized, that it's just the person feels frustrated, angry, scared, traumatized, those types of things that exist inside the person. But actually, it extends beyond the person. And when there's multiple people, it creates an atmosphere. And that atmosphere defines the place in the same way a church has an atmosphere, a neighborhood has an atmosphere. And that atmosphere is created by the trauma and the interactions between people in a community and between the police and the community, and it extends beyond the person. It's just not felt inside the person, but it's felt in the place. And we can measure that.
Okay.
Thank you both so much. And thank you, Rich, for your question. That was a great way to have us have this discussion that we intended to have today. There are two comments or questions in the chat, one from Darren. I'm not sure if you want to read it, but I can. Darren says, understanding that this focuses on Baltimore City, but crime and policing does not recognize local jurisdiction. How can this translate to more of a regional solution and getting those areas outside of the city to buy into this process? So I'm going to lead, and then I'm going to pass the mic to Dr. Brownstein. I think he has like some insight that will be beneficial to everyone. But I will say that at the moment, given this NSF support, we are focused in on Baltimore City for the Build and Broaden initiative in Baltimore City. We've had conversations about that what we're doing can be replicated beyond here. So ultimately, what we do here would possibly translate into being applicable in another area, and or, as Darren has shared, addressing some issues regionally. So again, I'm going to read it again. Understanding that this focuses on Baltimore City, but crime and policing doesn't recognize local jurisdictions. How can this translate to more of a regional solution and getting those areas outside of the city to buy into this process? So Dr. Brownstein, you have a comment about it?
I was just going to say, this is really the issue of generalizability and expansion of something that works. And the idea is, and in research, we always try to do work that will allow us to see if something can have the effect that we'd like it to have. And if we do, then we can try to expand it. So this, these things don't happen overnight. If we can work in Baltimore, where we know that there is some issues, because it's, the Department of Justice issued the report that said there were issues that need to be dealt with. So Baltimore is a good place to be doing this. And if we can make it work in Baltimore, in communities. Now, what the reason for having all of you folks here is that once we select the 8 neighborhoods, that's just for us to test this out. And then if we learn something from that, and we hope we will, we can expand that to other areas, and we can introduce that in other areas. If the Baltimore City Police Department is aware of what we're doing and is aware of, and also Baltimore County is aware of what we're involved in and what we're trying to accomplish and whether or not we accomplish anything. And if it works and if it helps, then it's something that we can share with folks later on. And we can also bring it to other places. I mean, Jim and I are in West Virginia, working in West Virginia now. And a lot of those communities are rural, and it's very different kind of situation, but they have some really serious problems also. If you know anything about Huntington, West Virginia, and the opioid problem and so on, will this kind of a process work in a place like that? We won't know now, but it's something that could be done next to see if you can expand this model. And I think the reason and also the thing about Baltimore is you've already done PACE. And it was really, there was a lot of promise, I think, from what I've read. Again, I can't speak for PACE, and I don't know, I didn't work on it, I don't know enough, but it seems to me that there was a lot of promise, and that's why what we're doing now really builds directly on that model. It takes the same kind of approach, and if we can, so the idea of research is to learn and to move forward. And if we can learn something that we, even in these small areas, so one of the things we'll be doing with the 8, we're going to select, well, we, with your help, hopefully, will select 8 neighborhoods, and we'll match them into 4 groups of 2. And 4 of them will get the intervention and 4 will not. And we're going to pre and post do surveys. We're going to look at official data, changes and things. In other words, if you're looking at change from one time to the next, do we see people saying different things, feeling different things? The survey will tell us a lot about how people view this, how the police view this. We can also look at data in terms of things like calls for service and number of crimes and crimes per calls and calls per service per crimes and so on. And we're hoping that you'll help us to figure out what data points we can look at to actually observe change. So if we go into the neighborhoods for some period of time, before we go in, we'll do a study, we'll do a survey, we'll come out, we'll do a survey, we'll collect data before, we'll collect data after, and we'll see if there was a change. And if we see that in the certain neighborhoods where we introduced the intervention, there was a change, then we can take that and build on that going forward, bring that to other cities, other places, but also within the city itself. I don't know if that helps answer the question or not.
Can I also respond to that, Dr. Pratt? one of the things we found in PACE was what we call the Baltimore centricity, right? Baltimore City was very clear, the community members were very clear that they wanted things for Baltimore. And so there's a lot of strengths in Baltimore. And so getting Baltimore City to buy into the process first is a way to get that to then go into other areas because they will market it. Baltimore community members and Baltimore City police officers will market the process outside and say, this works here, and you need to do it over here in order for it to not really affect us. You need to do it in Baltimore County because you are too close to us for you not to also include this process. Is one of those things. But if you remember Dr. Daniels and Dr. Pratt-Harris, one of the areas that they identified was the number of police officers that were not Baltimore City members, and the community members had a real issue with that there were just too many Baltimore police officers that were not living in the city, which is really what they didn't want. They were really against that. You know, people living in, Pennsylvania, New Jersey, and then coming into the city to work. So these are just some of the areas that we identified in PACE. So in response to that, we're really looking at making it work so much in Baltimore City that Baltimore City is who will market it outside of Baltimore City.
Thank you so much. And given what Dr. Archibald said, I'm going to offer a quick comment, and then I'm also going to refer to Brian Knight's question. And Brian Knight can actually ask it, but I'll also read it if it's better. So on this, on our team, we have people you'll recognize is not necessarily situated in Baltimore City. Dr. Archibald, Dr. Pratt-Harris, myself, and Dr. Daniels are professors at Morgan State University. Our 3 fellows are students at Morgan State University, 2 of whom were at least raised in the city of Baltimore, may have been also born in the city of Baltimore. They're living in the city of Baltimore. We have 1 fellow who's transplant. We're going to steal that person from Buffalo, keep that person here beyond the master's degree program. Everyone that I mentioned, everyone actually on our team has a vested interest in the city, but we also have a very unique group of persons who are doing this. Number one, there's a commitment and a commitment to this work that obviously extended beyond PACE. For example, Dr. Archibald is a Morgan alum. He was a faculty at Morgan State, and in fact, obviously was working with Dr. Daniels on that PACE initiative. He maintains quite a bit of things in the city of Baltimore. Dr. Brownstein, as he mentioned earlier, was a faculty at the University of Baltimore, and actually guided me as a master's student when I attended the University of Baltimore to address some of the very things that we're talking about here. And then Dr. Nolan, his expertise comes from what he's done in terms of his scholarship, his work, but he's also a former police officer who looks at these issues from that lived experience of being a member of a law enforcement community. So you do have that. And we recognize that sometimes community members, even in our findings and our reports, will say that there's concerns about law enforcement not necessarily being from the city. But as persons who are like intentional in research, we dig into what does that mean beyond that frustration that does exist. So that's a finding, but we go beyond it. And even for this team, we were looking at that. Who are we in this process, and how our team has come about in our role to carry out this initiative. So at this point, I am acknowledging Brian Knight's question in the chat. It was, what part of the community participation includes an educational component for residents? So at this moment, we recognize that sometimes our language can be very academic. And so over the course of the 3 years, we're going to make certain that, number one, we ask community members to check us regarding making certain that everyone understands what we are doing or what we're asking. We're also going to embrace how we are communicating in communities, and not necessarily always speak from the lens that we sometimes can speak from because of our being researchers and the like. The other thing I want to offer is, well, I will say that because this is Morgan State University and West Virginia University, we are academics. We're going to be sharing information about our institutions anyway. So some of those who we interact with can join us and to continue this type of thing. The last thing I want to say is that the word research can feel a certain way or be received a certain way, but what we are doing is participatory action research. And participatory, that P actually stands for, part of this, what it stands for is the participation of community in this. Action means implementation, actually doing something about what we're finding. And while you see, I guess the 7 of us who are part of the team, I'm not counting properly right at the moment, but either way, the larger team, as I said earlier, is the community. And the community voice, as I said, community, including people in neighborhoods and law enforcement community, that's the larger team, and everyone is going to be playing a part in so much as offering that. So for Brian, I'm not sure if I'm answering your question regarding the educational component, but I hope it was helpful. And Dr. Daniels is going to share as well.
I would like to also add is that, again, I want to make sure that that we're also clear that all of us are just not academics. I've been, and a part of what we imagined for PACE was that we can also use our skills of community organizing. I've been a community organizer for over 25 years, working with groups like Baltimoreans United in Leadership Development Build, but then also the Ministers Conference and the We Our Us Men's movement that is, of course, in Baltimore City. So the actual process of PACE, as we navigated it, also educated them around building community, building relationships, all of those kind of things, and even being able to talk through relational challenges. So a lot of that was, in some sense, educational as well, and several communities have continued to use those skills to build relationships, in some cases with adversarial kind of challenge, and go beyond that, learn how to move forward into policy development as well.
Thank you so much. We have a question from Rich. When you refer to the 4 pairings and that one of each pair will receive the intervention, could you provide more detail about what constitutes the intervention? So I'm going to try to answer that really quickly. The participatory action research model includes our first of all, having this conversation to enlighten the entire community about this initiative. That's the first thing. The next thing is what we were funded to do in the time frame we were funded to do this. So over the next 3 years, we will be engaging by identifying 8 neighborhoods in Baltimore City that we're going to be paying attention to over the next 3 years regarding how they are described, or how they would describe themselves or their experience as persons in those neighborhoods as relates to general neighborhood dynamics and police community engagement. Of the 8 neighborhoods, there will be 4 neighborhoods where we will be situated over the course of the 3 years, having intentional conversations with law enforcement and community together over the course of 3 years. Those 4 neighborhoods will initially get a survey for us to understand what's happening with their neighborhood at this point prior to these conversations, and then there will be one at the end to see the same thing. But over the 3 years, we'll be having these conversations, which are identified as focus groups over those 3 years. The other 4 neighborhoods will get a survey that we will use to find out what's happening there. And after 3 years, they're going to get the survey again, meaning they're not going to have those intentional conversations in those 4 neighborhoods. We recognize ethics and research the humanity of this whole thing, because we know this model is going to be useful. We believe it will be based upon our experiences. We like to offer this throughout the entire city, but resources and time are limited. So we're intentional in these 4 and being present and consistent over the course of 3 years for those 4. And again, paying attention to what happens to the other 4. And then hopefully at the end, there'll be additional funding and or in the midst of which we'll see additional funding to expand this beyond even the 8 neighborhoods. So we can be intentional in each of the areas. So I hope that answered that question. And if you all will take a look at the chat, Dr. Archibald offered something. I don't know if you want to read that. I think that's a statement that can kind of conclude or wrap up our conversation today. Just as a reminder, if it does wrap up our conversation today, the link for question and answers is consistently posted in the chat. This recording is going to be made available beyond the space here, and persons who are not available here can use the same link to ask additional questions, offer suggestions or comments. So Dr. Archibald.
Yes, I was really responding to Brian, but you're correct, because in this type of work, which we built out of in PACE, there is no power dynamics in terms of what Dr. Daniels was speaking in terms of academics versus community. It's really learning throughout. We're bringing a level of expertise. The community is bringing a level of expertise. There's experts in the room, experts in every space that we go in. And so there's a constant bi-directional education going. At one moment, I'm teaching something. At the same time I'm teaching, I'm learning something. The community is learning something, and while at the same time, they're also teaching, giving information. And so that becomes very important when we talk about this work. And so it's helpful, like what Rich did in terms of when we're using language that either side don't understand, we have to say something, right? And so we need to make the space brave and safe enough for people to say, I don't really know what you're saying. And that's on both sides, because the community could be talking a language that we don't understand. And so we want to be able to have that space where we're making language equal across the board. And so that's one of the strengths of the work. And we included, just like what's happening here, that's what we did in PACE, right? We included community members from the beginning to help even shape our questions. So as we're developing questions, they was like, they're not going to be able to really understand what that word means. So I wouldn't use that word. So give me a word. And then they gave us a word. And so that's how that will work in this process.
So with that being said, I think the mic was dropped. We just want to, again, thank everyone for their time on this Friday afternoon. Rolando has a question. Hand is raised. We still have 10 minutes. So go ahead, Rolando. And if you are speaking, you're muted. You would have to unmute. And if you are just giving him a thumbs up, I'll take it as a thumbs up. It's possible that Rolando was given a thumbs up. I'm going to just call it as that possibility. I'll hang out here if that person wants to chime in. But with that being said, again, everyone, thank you for joining us. Do have a great weekend. And I think the person is now unmuted. Okay, go ahead, Rolando. Thank you. Thank you.
Sorry. I'm on my phone and I'm not used to doing it on my phone. You use the word trauma. And one of the things that I did not hear is the part of the educational part of what create the trauma. Okay, one thing he also used West Virginia as an example. And one thing West Virginia have with Baltimore City is that there's no hope, which create that trauma. The failure of having education, failure of seeing a future, create trauma and says there's no hope, there's no reason for me to even try. And that's where part of the violence come about. The use and abuse of drugs become an outlet for these individuals that feel that there's no hope. Okay, interaction with police just become another problem. And the problem that we're having today with the police system is that the police system has been militarized. city. Now, police today have military weapon, AR-15, stuff that was never used, stuff that was never used before in policing. So you have tanks, you have all these different stuff that now you have individuals that's coming from military and they come with the trauma from overseas. Sit down, boy. No, they're in environments that they're not used to. One of the other problem that you have with policing, and unfortunately, Baltimore and many other cities do not require that these individuals have to live in the city. If they live in the city, then they'll get a better understanding of the people that they have to police, okay? So I don't hear in your study dealing with the educational part, the reason why people feel hopeless. You live in an environment where all you see is abandoned houses. There's no supermarkets, there's no parks, there's nothing. There's no activities for these individuals. So if you have no hope, you'll find negative things to do.
Thank you so much. So what Rolando is sharing is similar to what we have conversations, where we gather during our conversations when we're in communities. So our goal today is to acknowledge that we are about to begin to have these intentional community conversations in neighborhoods in Baltimore City. And we're going to be gathering in specific neighborhoods what people's thoughts are about what's happening in their neighborhood. And where, for example, Dr. Archibald talks about his area, his expertise as it relates to trauma, because we'll be acknowledging the potential that people will share, that that's a part of the story of the neighborhood. We'll be able to then report out based upon our findings from this series of conversations. This is what people are actually saying. This is what's actually happening. And for your information, our backgrounds speak to us addressing the very things you mentioned, the militarization of policing, trauma in general, all the different things you mentioned is like a part of part of what we acknowledged empirically, and in terms of like evidence of these things actually playing itself out. Now, beyond what we know empirically, or based upon our backgrounds or scholarship, we're going to be going to communities to ask them to tell us at this time what's happening, and engaging with law enforcement, what's happening, and how do we make these neighborhoods safe and strong. That is the goal in these participatory action, research-oriented discussions. What can we do? What can we do as a community to make this neighborhood safe and strong? So Rolando, definitely appreciate what you're sharing. And again, this is, if nothing else, serves as an example of like the kind of things we have conversations about.
I could let Rolando know, out of the PACE, we actually developed an intervention called HUT. It's called Healing Us Together. It's actually a community conversations that are happening in Baltimore City right now. So these are community conversations that are going around, and I can get you that information. So there are a number of community conversations that are happening in Baltimore. It goes in groups of 10, bringing community members together to go through this process of learning about the trauma and how to begin to work through it in a conversational piece. So I could drop that information. Dr. Daniels, actually through the Ministers Conference, they actually have a community member that actually leads that process.
And I don't want to underestimate, we don't want us to underestimate the intelligence of our communities as well. What we found out doing PACE is that quite a bit of them were educators, and even beyond that, skilled professionals as well, and also were able to contribute in that process in educating persons and others about trauma as well. So again, the In hearing, sometimes we just, I never underestimate that I'm going in to talk with community as if, again, I am superior, if that's maybe not the best word to use, but knowing that most communities are very much so skilled and very sophisticated in what their needs are and their wants as well, and educated about some things if they're heard.
Yes, for sure. And again, Rolando's statement definitely speaks to that collectiveness that will happen, that has happened when we all come together. So if nothing else, I'm just thankful for your sharing that here, because those who were looking at the video and those of us who are experiencing this can get a sense of what actually happens during those conversations. So we really appreciate that. We have 2 minutes, but we are going to table the discussion at this point because we all have our schedules. I'm going to make certain that the Zoom is actually available to share, and everyone will have access to that we've been in contact with, and you can actually share it beyond your own email inbox. And I thank everyone for your time. Again, if you have questions, post those using that link. We really would like to receive your questions, feedback, and comments. We also obviously recorded this session, so your questions that were here and the ones we were able to answer are included and documented here for our uses and to give back to community as well. And that's all she wrote. Have a good weekend. And again, thank you. Take care, everyone. Take care.